السلام عليكم ورحمة الله وبركاته. أنا اسمي محمد فاروق، المدير التنفيذي للجمعية الأفريقية لطب نقل الدم، أفريكا Society for Blood Transfusion. بيشرفني أكون مع حضراتكم في محاضرة أو عرض تاني كإحدى فعاليات المؤتمر العلمي لجمعية أصدقاء بنوك الدم الخيرية. وفي البداية أحب أكرر شكري تاني للجمعية اللجنة المنظمة للمؤتمر واللجنة العلمية على جهدهم وإتاحة الفرصة لي إني ألتقي بحضراتكم خلال المؤتمر. وأشكر صاحب السمو الملكي الأمير الدكتور فيصل بن مشعل بن سعود بن عبد العزيز، رئيس مجلس إدارة الجمعية، على رعايته الكريمة للمؤتمر واهتمامه بمجال نقل الدم بشكل عام. During this presentation, we will be discussing the guidance to identify barriers in blood services using the blood system self-assessment tool, or shortly BSS tool. Before I start, I would like to acknowledge the three organizations behind the development and the release of this tool: the World Health Organization, and namely Dr. Yoyun Mariyunun Gis, the team lead for the blood and other human products at the WHO headquarters. I would also like to thank the United States Agency for International Development, specifically the USAID Office of Maternal and Child Health and Nutrition, and Boston Consulting Group for their efforts in making this tool a reality after a long period of work. I would like also to acknowledge the team who developed this tool, the team of experts and consultants who developed this tool, and I was honored to be one member of this team. We really worked for a long time to get this tool out, especially that making a tool user-friendly is very difficult. Okay, first I think we need to start a bit with the history and the context of the development of this blood system self-assessment tool. If we go back to 2015, the global database on blood safety recognized 6 challenges faced by many countries and many blood transfusion services across the globe. Based on these identified 6 challenges, the World Health Organization launched in 2020 the action framework to advance universal access to safe, effective, and quality assured blood products. However, even after a couple of years of issuing this action framework, many countries were facing challenges to identify and prioritize the major barriers in their blood systems. And the WHO actually received many requests to provide guidance or a tool to help implementation of this action framework. Accordingly, the World Health Organization partnered with the United States Agency for International Development in 2022 to support the development of a blood system self-assessment tool. This tool is building on the USAID previously created Safe Blood Starter Kit, and it aligns at the same time with the working mechanism and principles of the World Health Organization, and it aligns with the action framework objectives. Based on this partnership, a core tool drafting group was assembled and this core group developed the first draft of the blood system self-assessment tool that was further reviewed by a larger group of consultants and professionals in the field of blood transfusion. After completing this revision process in 2023, a pilot implementation and testing of the tool took place in Ghana, and this was followed by adjusting the tool based on the lessons learned from this pilot implementation. The objectives of the BSS tool are very simple and straightforward. It helps countries to analyze and assess their blood transfusion systems through a stepwise approach to identify strengths and the challenges in moving toward full functioning blood transfusion system. The specific objectives of the tool: first, it enables comprehensive understanding of the different blood transfusion system structures and their components in a given country. In many cases, what you can find that yes, we have blood system in a country, but you merely find a person who capture or understand all dimensions of the blood transfusion system, all the structures related, how the system is operating, and so on. So really, using this tool will allow comprehensive understanding of the blood transfusion system in any given country. And it also promotes discussion among stakeholders of the blood transfusion system and allow them to assess their blood system and to identify the key strengths and the critical gaps. Also, the tool stimulates identification of investment in sustainable solution to bridge the identified gaps, because in a given country, maybe a lot of gaps are existing, but we have limited resources. So the tool also helps to identify what are the areas that we should invest in them in order to achieve sustainable solutions. And finally, the tool offers guidance on how to prioritize the local needs, because these needs are different from one country to another country, and according to the different environment and different circumstances, priorities in country A are not the same priorities for country B, for example. The foundation of the blood system self-assessment tool is the action framework. If you are not familiar with the WHO action framework, the action framework has 6 strategic objectives, building on the 6 challenges identified by the Global Blood Safety Database. The strategic objective 1 is to have an appropriate structure of the blood transfusion system that is well coordinated and sustainably resourced at the national level. And the strategic objective 2 is to have appropriate national framework of regulatory controls of the blood transfusion system. And strategic objective 3 is to have functioning and efficiently managed blood services. And strategic objective 4 to have effective implementation of patient blood management to optimize clinical practice of blood transfusion. And then strategic objective 5 is to have effective surveillance, hemovigilance, and pharmacovigilance system supported by comprehensive data. And finally, strategic objective 6 is to have partnerships and collaboration and information exchange to achieve key priorities and jointly address challenges. As you can see here, for each strategic objective, there are a set of high-level outcomes. Can be 1, it can be 2 or 3, and sometimes they are more. For example, for strategic objective 1, we have 4 high-level outcomes. So this was used as the basis to construct the blood system self-assessment tool. We will see later how they were used. However, these 6 strategic objectives, they were rearranged when we developed the tool in order to resemble the structure of the blood transfusion system in any country. So strategic objectives 1, 2, and 5 were grouped in one group, and this group was called Enabling Environment for a Safe Blood System. So this enabling environment include appropriately structured, coordinated blood transfusion system, appropriate national framework for regulatory controls, and functioning and efficiently managed blood, and number 5, effective surveillance, hemovigilance, and pharmacovigilance. This is the enabling environment for any blood transfusion system. Strategic objectives 3 and 4, they are grouped together to formulate the vein-to-vein value chain of the blood transfusion. So it's the blood supply side and the blood use side. And then strategic objective number 6, which is about partnership and collaboration and information exchange, was set to be in one category on its own. This is like some other kind of graphic representation of the grouping of the different strategic objectives and how they were grouped so we have the enabling environment, we have the vein-to-vein value chain, and we have the coordination. And the enabling environment itself, it is divided, for example, for the blood transfer, for the blood supply, mobilization of donors, testing for TGIs and ABO, ordering and transport of blood, and plasma preparation for plasma-derived medicinal products manufacturing. And the use side, it includes the supply system and the pre-transfusion testing at the transfusion facilities, and also the clinical knowledge of transfusion medicine, monitoring and reporting of blood utilization outcome. So how this is the basis. This is how the different strategic objectives were grouped, and then questions were developed for each high-level outcome, like small set of focused questions were developed for each high-level outcome. Typically, they are like yes or no questions. Sometimes they are questions that are asking about some quantitative data, but mainly they are yes or no questions. So, for example, for this first strategic objective about the structure, we have the first high-level outcome about the national blood system is appropriately structured, well coordinated, and integrated into the national health system. For this specific high-level outcome, you can see there are 6 different questions are developed to assess the maturity of the blood transfusion system in this area. So while using the tool, then the user should just like answer each question saying yes or no, or adding or providing the required information. Also, to the right side of the tool, there is like an empty space to provide any supporting information or supporting documents or references or comments. To use the tool, actually, the most important point about using the tool is the fact that it is not a one-man show. To use the tool, we need to involve all stakeholders and decision makers who are associated with each single high-level outcome or with each strategic objectives. So, for example, here for the enabling environment, the owner of the whole process is the senior representative from Ministry of Health, like maybe the minister himself or the deputy minister who is taking care of the blood transfusion. However, this person cannot complete the tool in his own, because the information required to complete the tool are also related to the other stakeholders. So to complete this part for the PSS tool, for example, we need to have the policy and the planning experts. We need to have budget and staffing decision makers at the Ministry of Health, regulatory and procurement specialists, clinical services, health data systems owners. So for each part of the tool, we need to make sure that we have all relevant stakeholders and they are led by the owner of this process, being, for example, as we said, in enabling environment, the senior representative from Ministry of Health, or for the vein-to-vein value chain, it can be the owner of the process will be, for example, the National Blood Service. So the group of the stakeholders, they should collect all references, all required information, and have a meeting together, preferably face-to-face meeting, and start to go through all questions related to their domain and answer them, provide the most accurate answer to the different questions related to the different high-level outcomes. After completing the answers to all questions related to one of the high-level outcomes, the tool automatically starts to quantify how many answers are yes, how many answers are no, and then if more than 75% of answers are yes, then this area or this high-level outcome will be like a strength, or we don't need to worry about this high-level outcome. If the number of answers with yes is between 50 and 75%, then this is an area of concern. If the number of yes answers are less than 50%, then this high-level outcome is a real critical challenge that needs to be considered urgently. And after completing all sections related to the tool, related to all strategic objectives, we will have this like dashboard for each part of the tool, dashboard for enabling environment, dashboard for vein-to-vein value chain, and another dashboard for the coordination. And in front of each high-level outcome, we will have the color either red or green or orange, according to the nature and of the answers given to this high-level outcome. So having this means that after we finish the tool, we will be able to see what areas that we have strengths, so we don't need to worry about them at the moment. What areas are really critical challenges, so we should consider them urgently, and also what areas are intermediate. Next steps after we have the tool completed, we need to assess the challenges, like one by one, the critical challenges that we identified through the tool, and assess their criticality to the success of the country blood transfusion system. And then we prioritize and sequence the actions that we need to do in order to address these critical challenges, and decide on the way forward with the key stakeholders. We need to focus more on how to what are the main principles to prioritize the challenges. These are the 5 principles that should be used in order to set the challenges in proper priority. The first one, the criticality of the challenge. So by simply asking ourselves, are other parts of the vein-to-vein value chain dependent on this challenge or not? What is the expected magnitude of change and scale of the population affected when addressing this challenge? So when we answer these 2 questions, we will be able to understand if this challenge is critical or not. And then we need to check also the health system maturity. How mature or developed the entire healthcare system? Are technological solutions and the online platform easily implementable as part of the healthcare system? Because maybe some solutions can be very feasible, okay, and very the outcome of implementing this solution is tremendous. However, they don't fit with the maturity of the healthcare system. And then we need to check the resources available, whether financial resources or human resources. So what resources are required? Human, financial, material, educational. We need to check what are the resources required to address this challenge. And does the expected impact of this investing all these resources to address this challenge can justify the outcome? In other words, if we invest all these resources, okay, is the outcome worth to invest all resources or no? And number 4 is the timing. Of course, timing can be considered also like one kind of resources. So some challenges may need years to address. Some other challenges can be addressed in few months. Okay, so we need also to consider how much time is required to address these challenges, and is the time invested, is the outcome justify the time invested? Of course, the more time we are investing in addressing one challenge, we should expect that higher or like bigger outputs are achieved. And then number 5, the 5th principle, the stewardship. How long, does the staff in the blood transfusion system or the healthcare system, are they caring about what they are doing daily? Are they committed to the blood transfusion service? Is there a dedicated leadership and full commitment of this leadership to the blood transfusion services? Because without this kind of stewardship and the leadership and commitment of staff, then if we cannot secure them to address challenges, then or to address one of the challenges. So for example, if the staff and the management, they are not committed to voluntary non-remunerated blood donation. And we find through the tool that voluntary non-remunerated blood donation is one of the critical challenges of the blood transfusion service. However, giving this non-commitment, no one is caring about it, then addressing this challenge of voluntary non-remunerated blood donation at this moment may not be the most feasible one to pursue. Also, the drafting team of the tool tried to visualize the development of different blood transfusion system using this 2x2 matrix. Actually, it is focusing mainly on the vein-to-vein value chain by examining the blood use system strengths, like the hospitals and clinics, and the blood supply system strengths, which means blood establishments. So if, for example, if the blood use system is very strong and the blood supply system is very strong, then we have a fully mature vein-to-vein value chain. And in such case, actions should focus on continuously updating the system and ensuring the sustainability and the close monitoring to proactively respond to any threat. If it is the reverse situation, like we have very weak blood supply system and very weak blood use system, then the whole vein-to-vein value chain is immature. And in such case, we will find remarkable deficiencies on both blood supply and blood use side, and actions should target system-wide improvements. We should target the areas, and if we invest, they will affect the entire system with prioritization based on criticality, dependencies, and local context. And of course, the system can be supply-oriented if the supply part is strong, but the use side is weak, like the patient blood management and the clinical use of blood is not really developed. And the reverse, if we have really good clinical interface, clinicians are well-trained. However, the supply they receive from blood is very little. So in such case, we will have use-oriented development, and in both cases, we should pursue different measures. Some practical and conceptual considerations related to the use of the tool I would like to highlight before concluding the presentation. The first one, the BSS tool is not intended to compare countries. So it should not be used at all to say that country A is performing better than country B in terms of blood transfusion system operations, because country A has less number of challenges. So this is not an objective of the tool. And the second one, the BSS tool is intended mainly to be used at the macro country level. It examines the blood transfusion system at the whole country level, because it's comprehensively capture the operational performance and also captures the enabling environment and coordination. It captures everything related to the blood transfusion system. So caution should be considered if the tool will be used at any other lower level. If we will use it at a regional level in the country, one small region or one small governorate in the country, if we will use it at the level of one blood establishment or a single service provider, we should be very cautious, because at this lower level, we will not have enough information about the enabling environment, the coordination, all these higher levels. So the outcome may be misleading. Likewise, the BSS tool, although it is designed to provide a holistic overview of the blood transfusion system as a whole, still based on the WHO action framework, still it can be used to examine the level of strength at the level of individual links of the vein-to-vein chain. However, as we said before, it should be noted that the overall strength of the whole blood transfusion system will be equal to the weakest link of this vein-to-vein value chain. Potential solutions to identified problems should focus on critical challenges. However, they should not be considered in isolation of other links of the vein-to-vein value chain. For example, you may be implementing a solution to one challenge related to the blood collection, and the solution that you are implementing will affect negatively another link of the vein-to-vein value chain. So cautious should be considered when we identify the solutions to different problems. And finally, we should always keep in mind that blood transfusion systems are dynamic, evolving, changing. Even the environment is changing, the technology, the knowledge. All these elements are not static. So there is first, the use of the BSS tool is not a one-time event. So you are not using it today. You identify the critical gaps and then you address them, and then everything is okay, and you don't need to do anything further. In fact, no, you need to reuse the tool again after addressing the gaps to make sure that still the system is strong in relation to all high-level outcomes. After 1-2 years, you need to reuse the tool again to make sure that with the changes in the environment, innovations, and so on, then the system is still efficient and we don't have many additional gaps. The WHO also issued some documents and guidances that relates to different strategic objectives. Of course, the presentations will be shared, but for further readings related to each strategic objective, you can check the relevant guidance. The tool is already developed and released. It's available online through this link. At the moment, it's available only in English, but the translation process of the tool is taking place, and it will be translated to the 6 official languages of the WHO: English, Arabic, French, Spanish, Russian. All the tool will be available in all these languages. with this, I would like to conclude my presentation and thank you once more for your attention. And I am happy to answer any of your questions if you have any question. Thank you very much. And it was my pleasure again to be with you.